Hi everyone, this is my informative speech for my Communication 154 class, and today I'm going to talk a little bit about the influenza virus and some preventative measures you can take. I know that we're coming to a close of the flu season, but the information that I'm going to tell you about will hopefully help you in future seasons. So, did you know that the influenza virus can survive on surfaces for up to 8 hours? And getting the flu vaccine can prevent 70 to 90% of influenza-specific illnesses. By simply getting the flu vaccine, you can prevent yourself from complications like bacterial pneumonia, ear infections, sinus infections, dehydration, and you can even prevent yourself from worsening of chronic medical conditions like congestive heart failure, asthma, and diabetes. As a nurse for the past 5 years, I've seen the infection firsthand and what it can do to a person. I found that with proper prevention through vaccination, along with good hand washing techniques and other tips, you can prevent becoming infected totally. I'm going to address some prevention and vaccination information, signs and symptoms of influenza, and some important key facts from this past flu season. So Medscape is a nursing website that I like to use to get the latest and most up-to-date information on any illnesses or diseases. And I did some research within this site, and I found that they claim that hand washing with soap and water is the most appropriate way to prevent this virus. They also say that some other preventative measures are to avoid touching your eyes or your nose and wash your hands before you do that, and to avoid sharing personal items with another person during an influenza outbreak. Using proper hand washing techniques, avoiding close contact with people who are sick, and staying home when you're sick, drinking plenty of fluids, eating nutritious foods, and staying physically active are all the best prevention tips that you can have. Also, receiving the vaccine each and every year will also help you in preventing the virus. So now that you know some preventative measures, I'm going to talk about the signs and symptoms of the flu. According to the World Health Organization, the influenza is a viral infection. It affects mainly the nose, the throat, bronchi, and occasionally the lungs. It'll last for about a week, and it's characterized by a sudden onset of high fevers, aching muscles, headache, and severe weakness. You can present also with like a non-productive cough and a sore throat. The best way that you know that it's different from a cold is that you will have fevers, high fevers, over 101, and you will be severely weak. Any of you that have had the flu in the past will know what I'm talking about, because you know that you don't even want to get up out of bed to go get treated and go see a doctor. So the CDC also says that you can have the chills, you can have a runny nose or even a stuffy nose, and some people will even have vomiting and diarrhea, but this is mainly more common in children than in adults. So now that you know about some of the signs and the symptoms of the virus, I'm going to talk to you about a little bit about the key facts from this past flu season. Most of the information that I retrieved was from the CDC website. They conducted a new study with researchers from the Vanderbilt University Medical Center, and they found that that getting the flu vaccine reduces the risk of flu-related hospitalizations by 71.4%. So you can see that getting the vaccine plays a big role in prevention. Among the elderly, the vaccine reduces the severity of illnesses and complications by up to 60% and deaths by 80%. They had an estimated 134.9 million doses of the flu vaccine distributed this past year. It's important to get the vaccine each and every year because there are many strains of the virus, but you have to remember that getting the vaccine isn't foolproof. You can still get the flu even though you received the vaccine, but the severity of the symptoms will be less worse. So I talked about some preventative measures, the signs and symptoms of the virus, some key facts from this past season. And if you remember anything from what I talked about, there are two things to remember. Get the flu vaccine each and every year and properly wash your hands. Doing this will prevent yourself and your loved ones from getting the flu and from potentially preventing something much more serious from happening. I hope you enjoyed my informative speech. I hope this helps you in future flu seasons, and thank you for listening.